Hi, I'm Aisha Holloway. I'm Professor of Nursing Studies at the University of Edinburgh, and I'm also a member of the Nursing Now team where I lead on evidence and research. Today I want to talk to you a little bit about my career, things that have inspired me, and the reason that I really come to work every day. So if I think about the first thing that got me interested in nursing, I always wanted to be a nurse. It was as simple as that. My early career involved clinical practice in acute medicine, intensive care, and acute medical admissions. Quite early on in my career, I realised that I wanted to make a difference, not just to what was going on locally, but I guess across the whole nursing profession. And there were many people along the way who inspired me, supported me, and still do to this day. I have many mentors even now, and I think that's really important if you're considering a career as someone who is influencing and shaping the future of health and social care. The first person that comes to mind was my head of nursing when I was at university studying to be a nurse. She told me something quite important that I think now is very important, and it's what I tell my students. She said she believed in me. She thought I could make a difference. If I were to reflect on obstacles and challenges I faced in my career, and there were many, I think the biggest thing was I always felt a little bit like an outsider. I felt I was never really part of a group because they were always ready to accept the status quo, and it was something that I was never able to do. So in a way, I was a bit of a disruptor, I would think, and sometimes that can be perceived negatively. But I think at points in your career, you will then, through your networks, be linked with other people who are like-minded, and I have to say I find that now. I have a network around me of people who do share the same issues, the same vision, the same hopes for our profession, and that's quite reassuring. However, that's not to say that you should surround yourself with like-minded people all the time. Challenge is necessary, but I think that certainly would be a piece of advice. It is all right to challenge as long as we are respectful of our colleagues and the people that we are challenging. I think we always think, if only I'd known then what I know now. So if I was giving any advice at all, I think it would be to someone early in their career. You have got to understand that you're never going to know everything straight away, and that's the joy of, I guess, a career in nursing. If I was thinking about giving any piece of advice or insight into a career in nursing where you want to influence, is always ensure that you are doing something for the right reasons. Certainly for other people and not for yourself. So I always think about my internal compass and what, I guess, situates me where in a place where my values are strong, my moral compass is situated facing true north, really. And it reminds me of Bill George's book, Authentic Leadership, which has been really one of the most crucial books that I've ever read, and it really speaks to me because I think being authentic is a key, I guess, way that I want to live my life now. And in any situation, certainly as a nurse, I think it's important to remember what our values are and what our purpose is. And I think our purpose at every moment in our day in terms of nursing is to ensure that we are providing patients with the best quality care that we can, that's safe and that is person-centred. Nurses' everyday practice is steeped in complex decision makings, not just in tasks, but in understanding what is going on in a situation to be able to do that, whether that is in relation to somebody who is acutely and critically ill, or when that is faced with some very sad situations, the bereavement of a patient and dealing with and responding to the needs of their families and friends. So I see nurses as offering a unique contribution to a patient experience and to the health system itself. One of the areas of focus for me in making a difference within the nursing profession is for nurses to have a political voice, to have a voice where they influence and shape policy, health policy, to impact patient care moving forward. And it's something that I've been involved with personally myself. I've worked at government, I've worked with colleagues in government to consider that nurses are not just implementers of health policy, but they create evidence that it's used to inform health policy, but they also should be shaping it. So we talk a lot about, have we got a voice, have we got a seat at the table? Well, yes, we have got a voice. Yes, we do have seats at the table, and where we haven't, we can stand, as a great colleague of mine once said. But I think it's fundamental for us as the largest group of health professionals to be able to be involved in those decisions, drive policy, inform policy, and develop it. I see the Nursing Now campaign as a catalyst for change. So this is just the beginning of our journey in the future to raising the profile of nursing, ensuring that we have greater investment in nursing by governments and by other organisations, and to us understanding the full potential of nurses and their role in providing universal health coverage and contribution to sustainable development goals. One of the key things that I think I contribute to the profession now is through mentorship. And you can never be too early in your career to mentor others. It's hugely important, and I think one of the key things is to understand the generosity that you can offer to other nurses, to lift them up, to support them, and through that you can actually support each other. We need a critical mass, and that is the opportunity that the Nursing Now campaign offers. We are a global campaign. We are reaching out to every nurse, every community, every government to have a dialogue and a conversation with our partners at WHO and ICN, and for that we are very grateful. So we must seize this moment in this once in a generation opportunity and take advantage of it with both hands. And when the campaign ends in November 2020, that is not the end of the campaign. That is the start of the future of where we can take our profession and what we can do with it to meet the challenges globally that we face in relation to health. Thank you for listening today, and hopefully, maybe in the future, our paths will cross and you'll be able to tell me about the fantastic, amazing things that you're doing.